Hello. Today we're going to look at Chapter 10, the muscular system. Once we get through the basics of muscles, when we start looking at the different muscles in the body, I am only going to focus on the muscles that you need to know for class and for lab. I'm not going to go over every single muscle because you don't need to know every single muscle. You do, however, need to know origin, insertion, and action for the muscles. So I will post a Quizlet that I made with all of this information in it for you already pre-made. You just need to study it. So let's get started with the muscular system. So what is the muscular system? It's all the different types of muscle that we looked at in Chapter 9, skeletal muscle, cardiac muscle, and smooth muscle. So it's any kind of contractile tissue, any kind of tissue that can actually contract for you. So we're going to look at how muscles make movement, how we name muscles. This will help you with remembering the names of muscles. And then we're going to look at different levers and leverages that are used to move different joints in the body. This is important. Muscles can only pull. They can never push. That's huge. They can only pull. So what one muscle group does, the other one undoes. So if you think your biceps and your arm, they're going to flex your arm so your hand is closer to your shoulder. But the triceps on the back side of your arm, they're going to undo what the biceps just did. So biceps flex, triceps are going to extend. They're going to undo that flexing. We also have what are called primary movers, and they produce those specific movements, like walking. Antagonists, they kind of oppose or reverse particular movements. So they're located on opposite sides of the body, like the triceps on the back side of your arm or the brachium, and the biceps on the front side. Your quads or quadriceps in the front, your hamstrings in the back. Those are all primary movers and antagonists. They work together or they work in opposition to do different movements. We also have what are called synergists. Those synergist muscles, they kind of help your primary mover muscles, but they kind of more fine tune some of that movement. So we don't get choppy kind of movement. We don't kind of trip all over the place. Synergists help to fine tune what you're trying to do. We also have, within synergists, we have what are called fixators. They kind of immobilize bones or muscle origins rather than enhance movement of primary movers. So they help to kind of give stability. We have a lot of fixator muscles in our spine. You don't need to know all of them, but we do have the fixator muscles to kind of just help hold you in place. Think of it that way. Fixators is kind of fix that movement, fix that posture, per se. So when we're talking about the different actions a muscle can do, we kind of look at the actions compared to the position of the muscle compared to the joint. So Again, if we look at our biceps, it kind of originates up in the shoulder and it attaches down in that forearm. It's going to allow you to bend your elbow. Or here, the example on this slide, we have pectoralis major. That attaches to your sternum, then it also attaches to it originates at your sternum and it attaches to your humerus. It allows you to flex your arm forward with your palm facing up. Here's another example from the back side. This is your latissimus dorsi muscle. It allows you to extend your arm backwards behind you. When that muscle contracts, because it originates at the spine here, but it inserts into that humerus. So that is what allows you to move your arm behind you in that extension type of movement. So some muscles, they will move. They could be primary movers for one action. They can be an antagonist for another action, or they can be a synergist for a different action even, different type of movement. It just depends on what you're trying to do. Muscles move and work in different ways depending on what movement you're trying to complete. So, when we name our muscles, they are named based off of a few different things. It could be the location of the muscle, like the bone or that body region. We have a muscle in our arm. One that you do need to know is brachioradialis. That humerus is also known as the brachium. Brachio, well, it's going to attach on the radius. Brachioradialis. That's how that one gets its name, based off of the two bones that it's associated with. Another one here that's in the slide, temporalis. That sits right on top of that temporal bone. So they're named for the bone that it covers. Remember I said when we were looking at bones, if you know the names of your bones, it'll help you with other chapters. This is one of them. This one, and it'll help with the nervous system too. Some muscles are named based off of their shape. That deltoid muscle, it's in your shoulder. That deltoid muscle, means triangle. Well, that muscle looks like a triangle. It attaches in the front of your shoulder and in the back of your shoulder. That's where it originates, up and over that shoulder. And then remember that deltoid tuberosity in the humerus, it comes down to a point right down there. Could be the size. Like your gluteal muscles. You have a gluteus maximus, gluteus minimus. We also have a gluteus medius. They're based on how big or small they are. Or adductor longus. It's one of your adductor muscles on the inside of your leg, that medial portion. Those all are based off of their size. We also have an adductor magnus. That's how big it is. Direction of the muscle fibers or fascicles. Rectus means up and down, like your rectus abdominis. In people where you may see defined muscles in their abdomen, this is the muscle you're seeing, is rectus abdominis. We also have a rectus transversus, an oblique muscle. So we've got different muscles just based off of the direction that they run or their origin or their number of origins. I've been talking about biceps and triceps. Your biceps have 2 heads, 2 origins. Your triceps have 3 origins or 3 heads. So it all just kind of depends on, they're usually named based off of these 5 characteristics or the location of their attachments. I talked about brachioradialis. Brachio is the origin, radialis is the insertion. So it tells you where it starts, where it ends. Sternocleidomastoid, or as we call it for short, SCM, but we're not allowed to use that. And here you can use it once you're done with whatever program you're going into. But that sternocleidomastoid, it originates at the sternum and the clavicle. It'll insert on the mastoid process. So it's named the insert, the origin starts first with the name, and the insertion is the last part of the name. That kind of helps with knowing their origin and insertion. Muscle action. That's another one. We have flexor or extensor. We have those in our forearms. We have muscles that flex or bend your wrist back towards your forearm, or extensors that allows your wrist to go the opposite direction, down towards your palms, your fingers going towards the posterior part, or the anterior part, sorry, the anterior part of your arm when in anatomical position. We can also combine several of the criteria. Of course, make it as difficult as possible sometimes, right? We have extensor, so we know it extends the wrist. Carpi, those carpal bones. Radialis, well, it's at the radius. Longus, so it's a longer muscle. So extensor carpi radialis longus. It's named for the action, the origin, the insertion, and the length. So let's kind of look at how fascicles can be arranged. Fascicles are those muscle fibers, the directions that the muscle fibers go, or the different shapes that these muscle fibers may make. Some of them go in a circular pattern. And they usually have some kind of name like orbicularis. We have one around our mouth. We have another one that goes around our eye, orbicularis oris, orbicularis oculi. Convergent, parallel, or pennate. So here's some of the different examples. Convergent. You can kind of see all of these muscle fibers in here converge together to one tendon. Circular. This is orbicularis oris, or your mouth. Fusiform. This is your biceps brachii. You can kind of notice in here, you've got 2 separate heads coming off, because biceps brachii has 2 origins. Parallel. All these fibers run in a parallel direction. This is sartorius. This is a muscle you do need to know. It starts up at the hip and it attaches down. It crosses over. This is the muscle that lets you cross your legs. That's the best description of that muscle. We can have a bipennate. You can kind of see two portions of the muscle here. A unipennate, there's only one group, or multipennate. This one is the deltoid that's in your shoulder. It has three separate parts that all come together. So our circular or convergent type of muscles. So we kind of went over this already. Circular, so all the muscle fibers are going to be going in a circle. That's what this does. Convergent, they all come together to one area. Parallel or fusiform, so those fascicles are all parallel to each other, or they're a spindle shape. Parallel like the sartorius here, or that fusiform is what kind of comes out and then it comes back down. Pennate, a unipennate, that fascicle attach only to one side of the tendon. Bipennate, fascicles insert on the opposite sides of each tendon, or a multipennate appears as feathers inserting into one tendon. So you see that bipennate, it kind of starts up here and kind of starts with a tendon at one side and finishes with a tendon at the other side. Or this deltoid, there's three different parts to it. Those three different parts all attach down to one tendon. Or that unipennate, extensor digitorum longus. It extends digitorum, your digits, your toes, and it's the longest. It's a long muscle. So the most common patterns usually are circular, convergent, parallel, fusiform, and pennate. The way the fascicles are arranged, they're going to determine what kind of motion, range of motion you do with those muscles specifically. And they also determine the muscle's power. How strong is that muscle going to be? So if the fibers are more parallel and long, they're going to shorten more, but they're not usually powerful. And again, power depends on the number of muscle fibers, as we kind of talked about in the muscle tissue chapter. Bipennate and multipennate, they have the most fibers, but they're the most powerful. They shorten a little, but they're extremely powerful with specific activities you want to complete. Let's look at our lever system a little bit. Our muscles tend to use this lever type system to do different types of activities. But what is a lever? Kind of a bar that moves on a fixed point or a fulcrum. Our joint is that fulcrum. What moves the lever part is that bar or that bone. Our effort is the force that we need to move that arm or leg or fingers even. Load is how much resistance, how much weight are you trying to move? So what do levers help with? By our bones and our muscles creating levers, They help us to move heavier loads, move things further or faster. We have a mechanical advantage, and that is when that load is really close to the fulcrum, and that effort is far from the fulcrum. That helps to pick things up. We have, when it's a mechanical disadvantage, that is when that load is really far from the fulcrum, but the effort is really close to that fulcrum. We'll look at pictures of these. The mechanical disadvantage is best for when load is moved rapidly over large distances. And our basic principles of a lever: if the effort is further than the load from the fulcrum, the lever operates at a mechanical advantage. If the effort nearer than the load to the fulcrum, the lever operates at a mechanical disadvantage. So let's look at this. Here's a mechanical advantage. Our fulcrum in this picture is this rock. Our lever is this stick. The load, we're trying to move this rock. This is a mechanical advantage, because that effort is further from the fulcrum. Our effort is all the way at the opposite end here, and it results in a mechanical advantage. It helps us to be able to move this rock. A mechanical disadvantage. Don't try this at home. That effort is closer to the fulcrum than the load is. Our effort, this guy jumping down on this seesaw type thing. Our fulcrum, this triangular piece, and the load is the woman standing on the other end. It may be a mechanical disadvantage, but what it's going to do is it's going to increase in speed. That'll allow this acrobat to fly up in the air and perform some tricks. So I said, don't try it at home. So our lever systems, we have different classes of lever systems. Our first class lever. Our fulcrum is between the load and the effort. Like a seesaw. If you ever played on a seesaw when you were a kid, or if you have kids and your kids play on a seesaw, that is a first class lever. Your scissors, those are a first class lever. So here you see that fulcrum is right between the load and the effort here. Again, your effort when you're using scissors is where your fingers are, and you're moving the scissors. The fulcrum is that screw in the middle, and the load is what you're trying to cut. Your neck, C1 on the skull, the atlanto-occiput or occipital joint. The atlanto, that first vertebrae, is C1, or the atlas, on the occiput. When you go to say yes, where that first vertebrae articulates with the occiput, that is your fulcrum. Your effort is your muscles contracting in the back of your neck when you tilt your head up. The load is the weight of the front of your head. That second class lever, we still have a load between the fulcrum and the effort, but think of it more like a wheelbarrow. Or when you're standing on your toes, or it's where that load is between the fulcrum and the effort. There we go. So we have our effort on one side, fulcrum on the other side, and the load in the middle. That is how that wheelbarrow works. Because your fulcrum is a wheel. Your load, well, whatever you have inside that wheelbarrow. And your effort is the handles you're holding on to as you're trying to move that wheelbarrow. Standing on your toes is also a second-class lever. The fulcrum, it's that ball of your foot. Effort is the muscles contracting up as you go up on your toes, while the load is the weight, your body weight trying to pull you down. A third-class lever. Effort is applied between the fulcrum and the load. Tweezers, forceps, and most of your skeletal muscles work this way. So your fulcrum is on one end, your load is on the other, while the effort, whatever you're trying to do, is in the middle. Like with tweezers, the fulcrum is that end point. The load is whatever you're trying to do with those tweezers. Pull out a splinter, pluck some hairs, whatever you do with them. And that effort is you pinching down on the tweezers. When you do bicep curls, the weight is always going to be in your hand. That fulcrum is your elbow. The effort is that muscle contracting up to allow you to move that weight. So in a mechanical disadvantage or speed levers, force is lost. But if we have a mechanical advantage or a power lever, they're slower, but they're more stable. So let's start looking at the muscles of the body. We have over 600 muscles, technically, but a lot of them are grouped together. A lot of them are, because they're in the same location, they kind of get named along those same lines. So I've included all of the tables from the book, but I also have sitting with me the muscle system, muscle chart that I pass out in lab, and it's also available on Canvas, of all the muscles you need to know. It gives you the description and where that muscle is. It shows, or it gives you origin, insertion, what the actions of the muscles are. We don't need to worry about innervation. It's on that chart, but we don't need to worry about it. We're only going to worry about the name, the origin, the insertion, and the action for these muscles. So when you're learning the names of these muscles, again, repetition is usually the best way. But kind of pay attention to the information from that muscle's name. That muscle's name may be able to give you an idea of where it's at. Kind of read that locate or relates that muscle to the location and the attachment. Act out the movements of that muscle's action. Feel that, see if you can feel that muscle contracting under your skin. Like if you bend your arm, you can usually feel that bicep contracting. Here are all majority of the muscles in the front of the body. And here they are in the back of the body. So we're going to start with the muscles of facial expression. What allows you to make different faces, whether you mean to or not? They are grouped into muscles of the scalp, and muscles of the face. So let's start. We have epicranius. This is one we need to know. Epicranius, technically it has two bellies, and each belly sits on top of the matching bone. Because we have the frontal belly and the occipital belly. So that frontal belly is going to be at that frontal bone. That occipital belly is going to be sitting on top of that occipital bone. So the origin of epicranius, that frontal belly, is that epicranial aponeurosis. The occipital is the skin of the eyebrow. Insertion of that frontal belly, is the skin of the eyebrows and the root of the nose. So for the frontal belly, the origin is the epicranial aponeurosis, and inserts at the skin of the eyebrows and of the nose. Because if you remember, the origin doesn't move, the insertion does. So if you think about if it attaches at your eyebrows, it's going to let you raise your eyebrows. That occipital belly. Let's look quick first. So here's this frontal belly. As I said, it covers that frontal bone, and it's going to kind of attach through here. That allows your eyebrows to move up. You can kind of see, just for reference, that epicranial aponeurosis is all through here. That is what both the frontal and the occipital bellies attach to in one way or another. So that occipital belly of the epicranius, the origin is the occipital and temporal bones. That's all you need to know it as. And it inserts in that epicranial aponeurosis. So if you remember, that insertion moves, it is going to pull the scalp posteriorly. I am going just based off of your chart and highlighting what you need to know based off of your chart. So if we look at this cadaver picture down here, you can see that occipital belly of that epicranius. That is what pulls your scalp posteriorly. So here's a better view, just another view. You see that frontal belly, and that occipital belly of your epicranius here. Off of this picture, this may kind of looks like it's most of what you need to know. Let's move on. We have orbicularis oculi. Orbicularis, I said, it's that circular type of muscle. Oculi, that's your eye. So it's going to be the muscle that goes around your eye. So the origin of epicranius is going to be frontal and maxillary bones. It's going to insert the eyelid. Again, I'm only highlighting the portion you need to know. What does orbicularis oculi do? It closes your eye. That is it. We have zygomaticus major and minor. Think of that zygomatic bone. They kind of go through that. They attach somewhere at the zygomatic bone. Since it's zygomaticus, it'd have to. So zygomaticus major and minor originate at the zygomatic bone. And it will insert at the skin and muscles at the corner of the mouth. Zygomaticus major and minor, they will raise the corners of your mouth upwards, or lets you smile. Orbicularis oris. Oris is for mouth. Orbicularis oris is your mouth. Orbicularis oris is going to originate in the mandible and the maxilla. And it inserts at the skin and the muscles at the corners of the mouth. Zygomaticus major and minor lets you smile. Orbicularis oris lets you close your lips. It's also known as the kissing muscle. That's the muscle that lets you kiss. Buccinator. Your buccinator muscle. That buccinator muscle originates at the maxilla and the mandible. And it's going to insert at the orbicularis oris. That is what lets you compress your cheeks. It's what helps to kind of move food around in your mouth when you're chewing. It lets you whistle if you can. These muscles they help your mouth do different things. Platysma. That platysma muscle actually originates at the fascia of the chest. It is that very superficial muscle in your neck. If you tense up your neck, you can see it in the mirror because that's what it action does, is it tenses your neck. It inserts at the mandible, the skin and muscle at the corners of the mouth. That is where our platysma goes. And again, it tenses that neck. So let's look. We already looked at the epicranius. We have the frontal belly and the occipital belly. We also have temporalis. Temporalis, it originates at that temporal fossa. It inserts at the coronoid process of the mandible. Temporalis, its action is to close the jaw. we have that orbicularis oculi around your eye. You can see zygomaticus major and minor. Major is bigger, minor is smaller. We have buccinator. That's what helps to compress your cheeks. From this view, you can only see about that much of it. Orbicularis oris around your mouth. Platysma, that is that very superficial muscle in your neck. And the last one on here you need to know is that masseter over here. That masseter, it originates the zygomatic arch. And maxilla. It inserts the angle and ramus of the mandible. And its action is it closes the jaw. These are all the muscles of the head and neck you need to know. And we will not look at these on the cadaver, so you only need to be able to identify these on a model. So here's all the different facial expressions and the muscles that do them. Like zygomaticus major and minor lets you smile. Orbicularis oris lets you pucker. We don't need mentalis, but it lets you pout. Platysma tenses up your neck. Orbicularis oculi lets you blink. And the frontal belly of the epicranius is going to let you raise your eyebrows. So here's some of them I kind of just went over, but they're muscles of mastication. Mastication means chewing. We kind of went through those, but here's the chart with all that information. Again, masseter, I just wrote it out, but it originates from the zygomatic arch and the zygomatic. Let's try that again. It originates at the zygomatic arch and maxilla. Those are what you need to know it as. It inserts at the angle of the ramus of the mandible. Temporalis. Temporalis, that temporal fossa, it originates and it inserts at that coronoid process of the mandible. Masseter, jaw closure, closing your jaw. Temporalis also closes your jaw. Again, buccinator. We already went through that, but that's a muscle of mastication. It lets you chew as it compresses your teeth. Again, our muscles of mastication, temporalis, masseter, buccinator, orbicularis oris. You need all of those. We do not need those. We do not need those. They are there more for your information. If you want to look more at them, depending on what program you're going into, you may need to learn more about them later. But I just included everything for your information. I'm only focusing on what you need to know. So that sternocleidomastoid, we do need this. We're going to look at what all of these do. Your suprahyoid muscles in general just kind of help with swallowing. But let's look at the muscles of the anterior neck and throat. None of these you need to know. Here you see that sternocleidomastoid. Off of here, you do need to know this. Sterno attaches to the, starts at the sternum and the clavicle, and it's going to attach to that mastoid. It is named for exactly what it does, or where it originates and where it inserts. You can also see it on this cadaver. These we don't need. Now we're going to look at these. Sternocleidomastoid, because it helps to move the head and neck. So let's find this sternocleidomastoid. The sternocleidomastoid, it's going to originate at the manubrium and clavicle. That's all you need to know, manubrium and clavicle. It inserts the mastoid process. That sternocleidomastoid, it's going to flex and rotate the head. It flexes your neck. So it allows you to bend your head from side to side, take your ear to your shoulder. That is what that sternocleidomastoid will do. We don't need our scalenes. We don't need the splenius. Now let's go to our back side. We have muscles that are called the erector spinae muscles. These erector spinae muscles are made up of 3 muscles: iliocostalis, longissimus, and spinalis. That is going from lateral to medial. So if this is your spine here, they're named from lateral to medial. I actually learned a mnemonic for these. I love spaghetti. I, iliocostalis, love longissimus, spaghetti, spinalis. So let's look at these. For all 3, iliocostalis, longissimus, and spinalis, you just need to know that they originate at the iliac crest. Technically, that's all we're putting it as. For insertion, iliocostalis, insert at the ribs. Longissimus, they insert at the transverse process. Spinalis, spinous process. All 3 of them, the action is they extend, just write this all out, extend and bend the trunk laterally. Extend and bend your trunk laterally. All 3 of them, that's all you need to know about their action. Origin, all 3 of them are the iliac crest. And then iliocostalis, costal, ribs. Longissimus, transverse process, spinalis, spinous process. That is all you need to know about those. And we don't need the other two. Splenius capitis. We'll go through that as soon as we find it on the chart. We need splenius. We have splenius capitis. We have splenius cervicis. These are muscles of the neck. Let's look. This is the anterior, so that's the sternocleidomastoid. The rest of those we don't need. Here are those erector spinae muscles. We have our iliocostalis, longissimus, and spinalis. So they are 3 separate rows of muscles. You don't need to know that there's an iliocostalis lumborum, iliocostalis thoracis, iliocostalis cervicis. You don't need to know that much detail. You just need to know that there's those 3 muscles that exist in your back. You will need to identify them on the cadavers, and I will be showing them during lab time. Let's look at our breathing muscles. We have our external intercostals, between costal ribs. So between the ribs, those external intercostals, they originate at the inferior border of the rib above, while they insert at the superior border of the rib below. So if I have ribs, they originate here, and they're going to insert here. They help with inspiration, and they pull ribs to elevate the rib cage. Internal intercostals. Yes, between our ribs, we have 2 layers of muscle. So the internal intercostals, they originate at the superior border of the rib below and insert at the inferior border of the rib above. So if I draw my ribs again, they are going to do the opposite of the external. So they originate at the inferior ribs and they insert into the superior ribs. Their action. Internal intercostals help with expiration. So they are going to pull the ribs together and depress the rib cage. The last muscle that helps with breathing, of course, is our diaphragm. Our diaphragm, it originates at the inferior border of the ribs and the sternum. And it inserts at the central tendon. Your diaphragm is the prime mover of inspiration, and it flattens the dome. So those are our muscles of inspiration. If we look, those external intercostals, they are going to traverse more in a posterior, away from posterior type direction. The internal intercostals, they're going more in an anterior type of direction here. Your diaphragm. This, just sort for an idea, this is the central tendon of the diaphragm. This whole portion I'm coloring in yellow. This is where this muscle will insert into. Here it is within a cadaver. You see that central tendon, then you see the muscular part of that diaphragm. We can see this in the cadavers, but it will not be asked on a cadaver. It may, if it's asked for the practical, it will be an image only. So let's look at the muscles of our trunk. And let's look at our abdominal muscles here. Our first one, rectus abdominis. Our rectus abdominis, again, that is the muscle that you see if somebody has really nice defined abs. This is the muscle you're seeing. That rectus abdominis, it'll originate at the pubic crest and the symphysis. And it'll insert at the xiphoid process and the costal cartilage of the ribs. What does that rectus abdominis do? Well, it helps to flex and rotate the vertebral column. We have external oblique muscles. Those external oblique muscles, they originate at the last 8 ribs. And they will insert at the linea alba in the pubic crest and iliac crest. Our internal obliques. Our internal obliques, they originate at the lumbar fascia and the iliac crest. The internal oblique will insert at that linea alba, pubic crest, and the costal cartilage of the last ribs. Both internal and external obliques, they are going to flex and rotate the trunk and they will help, and vertebral column. So they flex the vertebral column and they do trunk rotation. Both internal and external obliques are the same movement. Transversus abdominis. Transversus abdominis originates at the inguinal ligament, lumbar fascia, and iliac crest. It is going to insert the linea alba and the pubic crest. They compress the abdominal contents. Let's look at these. They are all different layers throughout your abdomen. You see that rectus abdominis. This is where you see most people here usually see at least that 6-pack. Sometimes you see that 8-pack. That's what those are referring to. We have our external obliques. External runs in an inferior type pattern. Internal oblique runs at a more superior type of pattern. Transverse abdominis, transverse, they run in a more parallel type of pattern. There was one muscle of the neck that I just found on your sheet that I am going to come back up and find for us, which would be the sternohyoid. The sternohyoid originates at the posterior manubrium, and it's going to insert at the hyoid bone. That sternohyoid is what depresses the larynx and hyoid bone. Let's find that, whoops, in the neck. The sternohyoid goes from the sternum down here, you kind of see it, and it goes up to that hyoid bone. Let's go back down. We were at our abdominal muscles. Here we go. So here's another look at some of these muscles here. You see the external obliques as they go up. Internal obliques, they have more of a down pattern. Rectus abdominis. Rectus, they are straight up and down. They form those abdominal, those 6 or 8-pack muscles. Transverse abdominis. Transverse, that's going to go straight side, parallel. So this is just another view to kind of see how they're all different layers. You get your rectus abdominis, your internal obliques, your external obliques, and your transverse abdominis. There's lots of different layers that make all of this up. So we do not need to know any of these muscles of the pelvic floor. These are here for your information. Now let's go to the muscles of the chest. Sorry, I'm just checking your diagram. We do need pectoralis major. We need deltoid. Here's another view of sternocleidomastoid. Biceps brachii. And these are the muscles that we need for class. Here's another view. You get pectoralis major. your deltoid, your sternocleidomastoid. You can see external oblique here, rectus abdominis here. You even see the internal intercostals, your biceps brachii. Let's look at where pectoralis major originates. Pectoralis major originates at the clavicle, sternum, and the ribs, or sorry, cartilage of the ribs. Pectoralis major will insert at the greater tubercle of the humerus. Its action is it will flex the arm, it helps adduct, so bringing your arm back down towards your body, and medially rotate the arm. What about our deltoid up here? Our deltoid is going to originate at the clavicle, at the acromion, and spine of the scapula. It will insert at the deltoid, deltoid tuberosity. And its action is it abducts the arm. So let's look at the muscles of the back. We have our trapezius. The trapezius is going to originate from the occipital bone, thoracic vertebrae, and spinous processes. Going to insert the acromion and spine of the scapula, and then that lateral portion of the clavicle. It will help to, well, it does help to stabilize that scapula. It raises or elevates, rotates, and retracts the scapula. We have our rhomboids. We have a major and a minor, so we technically have two of them, but we just need to know them as rhomboids. They are going to originate, originate at the thoracic spinous processes. They are going to insert at the medial border of the scapula. And all we need to know that the rhomboids will do is they stabilize the scapula. So let's look. We have our trapezius muscle. That is the more superficial muscle of the back. Underneath that trapezius, you can see the rhomboids. This group of muscles right here. We just need to know them as the rhomboids. So here's that trapezius. Trapezius is kind of a trapezoid shape. Then our rhomboids. Here's where we have pec major and pec minor. So pectoralis major, again, it inserts or originates at the clavicle, sternum, and cartilage of the ribs. It's going to insert to the greater tubercle of the humerus. That pectoralis major will abduct and medially rotate the arm. It will also flex that arm. Deltoid. The clavicle, the acromion, and spine of the scapula. Inserts deltoid tuberosity of the humerus. And it's going to abduct the arm. So here we see that pectoralis major and that deltoid. And this deltoid goes all the way around. It goes all the way around to the back. And then it kind of has that triangular shape down to that deltoid tuberosity. And our pectoralis major is the one through here. Let's look at our latissimus dorsi. Latissimus dorsi will originate I'm just going to write this out, at this spinous processes of the thoracic and lumbar vertebrae, iliac crest, and last, ribs. That is where the latissimus dorsi originates. It inserts intertubercular sulcus of the humerus. Latissimus dorsi. It will does arm extension or extends the arm. It adducts the arm and it medially rotates the arm. So here is our latissimus dorsi. It is the lower portion in our back. I will show it to us in the lab. Let's look at, most of these muscles here are on the scapula. It's somewhere. So we have our supraspinatus. Supra, above, spine, above the spine of the scapula. So it's going to originate at that supraspinous fossa. It will insert at the greater tubercle of the humerus. All you need to know that this supraspinatus, that it initiates arm abduction. It's used like the first 15 degrees of arm abduction. So taking your arm from the side of the body away, it's only about 15 degrees. Infraspinatus, infra, below the spine. So it will originate in the infraspinatus fossa. It also inserts at that greater tubercle of the humerus. Infraspinatus will laterally rotate the arm. Teres minor. It originates at the lateral edge of the scapula. Whoops. And it will insert at the greater tubercle of the humerus. Its action is laterally rotating the arm, same as infraspinatus. Teres major. It originates on that posterior surface of the scapula. It's going to insert the intertubercular sulcus of the humerus. So that inserts at the intertubercular sulcus. That's what you need to know it as. Teres major. It will extend, medially rotate, and adduct the arm. So here where you saw latissimus dorsi, you're going to see teres major is actually below teres minor. Infraspinatus, supraspinatus. Supra is above the spine. Infra is below the spine. We have teres major or minor. Teres major. They all have to do with the scapula. Remember, major is below minor. Let's look at our arm muscles. We're going to start with our posterior arm muscles. We are going to look at the triceps muscle, that triceps muscle is going to originate at the inferior margin. I'm going to write it over here because it's kind of long. That inferior margin of that glenoid cavity. The posterior humerus. And groove of the posterior humerus. That is not its insertion origin. There we go. That is the origin of the triceps that you need to know. It inserts. The olecranon process. What does our triceps do? Well, they're going to extend the forearm. We have our biceps brachii in the front of our arm. Triceps is in the back side. Biceps is in the front. So our biceps brachii, it has a long head and a short head. The short head originates at the coracoid process. The long head is the superior rim of the glenoid cavity. So that long head originates at the superior rim of the glenoid cavity. Biceps brachii is going to insert at the radial tuberosity. It flexes the elbow or forearm and it supinates that forearm. Brachialis. Brachialis will originate the anterior distal portion of the humerus. It is going to insert at the coronoid process of the ulna. Brachialis flexes your forearm. Brachioradialis. It originates at the lateral ridge of the distal humerus. It inserts the styloid process of the radius. Brachioradialis will flex the forearm. Let's look. Here's our triceps muscle. We just need to know that this is a triceps muscle. It's on the back of the arm. Here you can see the biceps. You see brachialis and brachioradialis. So our biceps are in here. Brachialis sits kind of behind the biceps, and then the brachioradialis. Let's look at some of our forearm muscles. We have flexor carpi radialis. Flexor carpi radialis originates at that medial epicondyle of the humerus. Flexicarpi radialis is going to sorry, I'm highlighting the wrong one. It's going to medial epicondyle of the humerus, and it inserts at the base of the second and third metacarpals. It flexes the wrist or hand, and it abducts the hand. Palmaris longus. will insert at the medial epicondyle of the humerus. It is going to insert at the palmar aponeurosis. Palmaris longus is a weak hand or wrist flexor. Flexor carpi ulnaris. It originates at the medial epicondyle of the humerus. If you're noticing something, the flexors are coming from that medial epicondyle. It inserts at the base of the fifth metacarpal. It will flex and abduct your hand. Flexor digitorum superficialis. It originates again at the medial epicondyle of the humerus. Flexors are the medial epicondyle. It'll insert at the middle phalanges of the second through fifth fingers. It will flex the wrist or hand and middle phalanges of the second to fifth fingers. Flexor pollicis longus. Flexor pollicis longus again is going to originate the medial epicondyle of the humerus. That's where it originates. It will insert. Pollicis is your thumb. So the distal phalanx of your thumb. It will flex the thumb. Flexor digitorum profundus. It originates at the anteromedial surface of the ulna, coronoid process, and interosseous membrane. It inserts to the distal phalanges of the second through fifth finger. Flexor digitorum. It will flex the digits. So let's look at some of this. So we have flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, flexor pollicis longus. You still see brachioradialis from this view. So here's flexor digitorum superficialis. This muscle through here. Here you see flexor digitorum profundus. Profundus means deep. Flexor pollicis longus. Some of these, the best way to know which one is which is to follow the tendons. Like palmaris longus, look at how long the tendon is, and it goes all the way here. Flexor digitorum. Each of these tendons is going to go off to their own finger. Flexor digitorum profundus, same thing. It's just deeper than superficialis. We looked at flexors. Let's look at extensors. And we have brachioradialis. We've already looked at that. So extensor carpi radialis longus. It originates at the lateral epicondyle of the humerus. It inserts at the base of the second metacarpal. Extensors are on the lateral epicondyle. Flexors are the medial. Extensors are the lateral. Extensor carpi radialis is going to extend the hand and abduct the hand. Extensor digitorum. Lateral epicondyle of the humerus or origin. It inserts at the distal phalanges of the second to fifth fingers. It's going to extend the fingers in the wrist. Extensor carpi ulnaris, going to originate again at the lateral epicondyle of the humerus. We'll insert at the base of the fifth metacarpal. It extends the hand or wrist and it abducts the hand or wrist. Those are all the muscles you need to know in your forearm. It's a lot, I know. Let's look at our extensors. So we have extensor carpi ulnaris, extensor carpi radialis longus, and extensor digitorum. Kind of watch where the tendons go. One's on the ulnar side, one's on the radial side, and then the extensor digitorum, of course, is going to go to digits 2 through 5. Pollicis, or your thumb, has its own tendon. So here's some charts direct from your book on what muscles flex, extend, abduct, adduct, medially rotate, and laterally rotate. And it goes through every muscle that we've looked at. We do not need to know these intrinsic muscles of the hand. So these are here more for your information and what you want to know. So let's start going through the muscles of the leg. We do not need iliopsoas, and we do need sartorius. So sartorius. Sartorius is going to originate at the anterior superior iliac spine. It's going to insert on the tibia. That's all you need to know. It flexes, abducts, and laterally rotates the thigh. Sartorius is a muscle, again, that lets you cross your legs. There we go. So here is sartorius. It is this muscle that comes here and goes all the way across. Let's look at your adductors. These are in the medial portion of the leg or your thigh. The adductors. There are 3. There is adductor magnus, adductor longus, and adductor brevis. For all 3 of them, you just need to know that they originate at the ischial and pubic ramus and the body of the pubis. The body of the pubis. For all three of those. As for insertion, linea aspera. They are all going to adduct, medially rotate, and flex the thigh. They all have the same motion. Oh, I'm highlighting pectineus. We don't need pectineus. Gracilis. Gracilis originates the pubis and it inserts at the tibia. Going to adduct. It is a weak adductor, but it adducts the thigh. But it's also used for a forearm transplant. It is a long, skinny muscle that is in the most medial portion of your leg. So here's our adductors. You see adductor magnus, adductor brevis, and adductor longus. Brevis is short, longus is longer, magnus is just huge. Then gracilis is actually going to sit like right here. This is where gracilis will sit. Let's look at our quadriceps. Here you can see gracilis in here. Gracilis again is the one that just comes immediately down. So we're going to look at our quadriceps. We have vastus medialis, vastus lateralis, rectus femoris. And then we also have vastus intermedius, which you cannot see unless you remove the head, remove rectus femoris. If you remove rectus femoris, you'll see vastus intermedius. Like this. Here is vastus intermedius, right in the middle. You still have vastus lateralis here. And you still see vastus medialis. We just got rid of rectus femoris. We will come back to those. Let's go to our gluteal muscles. Okay. We have vastus intermedius here. Vastus intermedius is going to originate at the femur. It's going to insert at the tibial tuberosity. And it does work to extend the leg. Gluteus maximus. Okay, went back a few slides, found all the rest of my quadricep muscles. I knew we were missing something somewhere. So here's the rest of the quadricep muscles. We have rectus femoris, vastus lateralis, vastus medialis. Rectus femoris is going to insert at the anterior inferior iliac spine. Going to insert at that tibial tuberosity. It will extend the leg and flex at the thigh. Vastus lateralis is going to insert at the or originate at the greater trochanter. Intertrochanteric line and linea aspera. It will insert the tibial tuberosity. Again, extends the legs. So extend the leg and it flexes the hip. Vastus medialis, it originates the intertrochanteric line in the linea aspera. Going to extend that leg. There we go. Now we got them all. All 4 of our quadriceps muscles. Now let's go to those gluteal muscles. Sorry. Our gluteus, whoops. Gluteus maximus. Our gluteus maximus is going to insert or originate, sorry, at the ilium, sacrum, and coccyx. Gluteus maximus will insert at the gluteal tuberosity and the IT band. Gluteus maximus will extend the thigh. Gluteus medius. It originates at the upper lateral ilium. It will insert the greater trochanter of the femur. It adducts the thigh. It is also a synergist of maximus. Gluteus medius originates at the ilium, inserts the greater trochanter of the femur. It will adduct stabilize the hip and a synergist of maximus. That is its action. So from this view, you only see gluteus maximus. Well, you can see gluteus medius as well. Here's gluteus maximus. Some of these, we'll be able to see these. You see gluteus minimus down here. Still part of, you can see where gluteus medius was cut. You can also see where gluteus maximus was cut. So let's come down to our hamstrings. We have biceps femoris, which has 2 heads. The long head is at the ischial tuberosity, your sit bone. The short head is at the linea aspera and distal femur. It works to extend the thigh and flex the leg. Semitendinosus. Tendinosus, it has a long tendon. It originates at the ischial tuberosity and it inserts the tibia. It extends the thigh and flexes the leg. Semimembranosus. Ischial tuberosity. It originates. It inserts at the medial condyle of the tibia. Again, same thing, extends the thigh and flexes the leg. You see semimembranosus sits underneath semitendinosus. When we look at it in the cadaver, you'll see semitendinosus has a longer tendon to it, and then semimembranosus is right underneath it. Then we have biceps femoris. We have the long head through here and the short head just underneath it. Semitendinosus, semimembranosus. So let's go to the front of the leg. We are almost done with these. We're at the bottom half of the leg. We have tibialis anterior. Whoops. There we go. Tibialis anterior. It's going to originate at the lateral condyle of the tibia and the proximal tibia. Whoops, one too many letters. Tibialis anterior is going to insert at the tarsal and metatarsal 1. Tibialis anterior, it dorsiflex the foot. Extensor digitorum longus. That originates at the lateral condyle of the tibia. And again, the proximal tibia. It will insert middle and distal phalange of the 2nd to 5th digits or toes. Toe extension. That's what allows you to flex your toes up. So here's tibialis anterior and extensor digitorum longus. Tibialis anterior goes in the front of the tibia, and right next to it is extensor digitorum. You notice the tendons. They come all the way out. Watching where the tendons go lets you know what it is. Here you can see tibialis anterior. One we don't need, extensor digitorum longus. The last part. Okay, we have gastrocnemius. This is on the back side of our lower leg. Gastrocnemius is going to be the medial and lateral condyles of the femur is where it originates, and it inserts at the calcaneus via the calcaneal tendon, which you do need to identify that calcaneal tendon. Gastrocnemius, plantar flexes the foot. Points to your toes, lets you stand up on your toes, all of the above. Soleus. Soleus is just underneath that gastrocnemius. It originates the proximal tibia and fibula. It inserts. Calcaneus. Plantar flexes the foot again. So here you see gastrocnemius. That is the muscle you see when you look at somebody's calf. Again, that's that muscle you see in the back. Then underneath it is soleus. Here you can also see tibialis anterior and extensor digitorum longus. Again, some of these muscles here are just for your information. Gastrocnemius. And you can kind of see soleus from there. You can see a little bit of it from there. But there's our soleus muscle. Here you can see it because I've cut off from the heads of the gastrocnemius. See all the muscles of the posterior part of the leg. We don't need all the different layers to all these muscles in the foot. Just kind of here for your information. Again, here's another chart showing what muscles do what movements, if that helps. And that is the end of this chapter. We have only covered the muscles you need to know for lab. And those will be the only muscles that'll be asked on the written test as well. Thank you very much. Bye.